And a very pleasant good afternoon to you. Gabe Farias and Dr. Danny Kellum Jr. with Kellum Physician Partners with your EasyConnectMD.com video podcast. Of course, this podcast is brought to you by EasyConnectMD.com. Only $39.95. See a provider. Fast, quick, quality medical service. And Dr. Kellum, EasyConnectMD is something that we created, a platform that's easy to use. I can't emphasize easy to use more. Couple of steps, 15 minutes, you're in and out. And it's like going to the emergent clinic without having to go inside to a crowded waiting room.
Absolutely. First of all, good to see you, Gabe. It's
Yes,
been
sir.
a little too long.
It's been a while.
You look nice.
You look like you've lost some weight. You dropped a few pounds, a few lbs. It's these thinning cameras that we have now.
It's COVID.
What's weird is it makes me look fatter. Like my face looks fatter now. I don't understand why.
I do.
Food.
Not understand
It's
either.
like food. It's like the camera adds 10 pounds. That in food, right? Is that what it is?
That's exactly what it is.
EasyConnectMD.com. What a useful tool for people, especially now during the time of the pandemic where they don't want to go into a crowded waiting room. They can go online, $39.95, and see a provider.
Absolutely, Gabe. And as we've been doing for a while now, we've been really trying to perfect our telemedicine platform. And unfortunately, through this year, it's kind of been thrust upon us. And so we've really evolved what used to be Kellum Connect into EasyConnectMD, and we did that for the reason of really creating a lot of ease of use. And so we have a wonderful product now. There's just a few steps, really, in terms of putting in your name, picking a pharmacy, seeing the doc, and then being done with that. And so it's a wonderful tool amidst all of this craziness that's happening around us to get simple things taken care of without having to go into an urgent care. Can do it from the safety of your home, and it's a technology that really creates some ease for all levels of users.
And what you talk about in the craziness that we're in right now, we're talking about COVID-19. We've had some podcasts early on when this was just starting. Now, I'm not going to say that we're rounding third, heading home, but we're heading in the right direction. Vaccines are starting to come out. Can you talk a little bit about a couple of vaccines? That one was just recently approved or has the temporary approval by the FDA, and another, Moderna, that's almost here.
Yeah, we are rounding the turn, and we're also hesitant to say that because it's been such a devastating year for businesses and families and lost loved ones, and it's something that we'll never forget, and it certainly will stay in our heart forever. And what's really important, I will say, before I answer that question, is really, although we're rounding third, this is the time that we really, really need to be diligent because we are so close to a positive outcome with this. Is if we drop our guard in any way whatsoever, it can really be devastating. And the idea that we're months away from something that could save all of us and bring us back to some semblance of normal. If we drop our guard, we lose someone we care about because we're just a little bit careless, or more importantly, just a little frustrated by all of this going on.
And it's because people think we're close, and they're saying, "Oh, well, if we're close, then we can let our guard down," and that's not what you want them to do.
No, there's definitely space for elation with all of the positive things that are coming out right now, but there certainly needs to be tempered with caution because we're not quite there. We can see the finish line for sure, and science has done a wonderful job, speaking to that, of creating these new vaccines that are coming to the market. In particular, the one that we're seeing first is one from Pfizer, and it's an interesting vaccine. It's run new technology based on a platform that's really been around for a little while. Scientists have worked on this for more than just this 10 months. It's really been years in the making, but it's allowed, with COVID coming out, an opportunity to utilize that platform of technology specifically to help combat this COVID-19. And what they've done is a wonderful job in terms of the research and the delivery, and now hopefully with the distribution so that we'll be able to give vaccines to individuals. There's a lot of apprehension when it comes to vaccine taking, but the one thing that I really think is really important for people to understand is, although the process has been shortened to really expedite delivery of this vaccine to save all of us from this horrible pandemic, but the science has been solid and it's been slow, and the safety data on this is amazing. They've used numerous hundreds of thousands of people, but in particularly about 60,000 with these first two that are coming around globally, and have looked at safety data. And what we know is that the vaccines are super safe. They're very efficacious. and they really do protect people. And even in the small percentage of people that get the disease despite the vaccine, it protects them from moving on to the more serious complications of COVID. And that's really what's important, that people understand that this is, although it seemingly has come at a feverish pace, and there is no doubt it is historic in its nature, and science has certainly saved the day with this. The technology and the understanding of this goes way beyond just this 10-month period of time. And so people should have comfort in that for sure.
Yeah, and I want to kind of stick to that point because people, there's a small group of folks out there that are just completely anti-vax. They don't trust it. But you, as someone who obviously is rooted in science, you've seen this process, you trust this process, even though it's happened a little more expeditiously than normal when we would look for a vaccine. You trust this vaccine and you trust the science behind it.
I do trust this vaccine, and I will say I will be the first to roll up my sleeve to get this vaccine when it comes, without a doubt. But in saying that too, I think that I'm a big believer in personal responsibility and allowing people the opportunity to believe what they want to believe. But I think it all has to be rooted in knowledge and not necessarily presumption. And so what I share with our patients is that, I am a big believer in this vaccine. I do think it will do well for people. And in those who choose to not get the vaccine, although we may have good penetration within our country in terms of the amount of people vaccinated and hence the slowing of the spread, which I think is really important. Not getting the vaccine and having everybody else get it does not give you the opportunity to be free of the consequences of COVID. And the problem with COVID is that it's indiscerning, and so anybody and everybody can get it, and it's so unpredictable in terms of who gets the severity of the disease. And although it's very true that only a small percentage of people die from COVID-19, it's the great amount of people that suffer from the consequences of it, whether it's long-lasting fatigue, headaches, pulmonary issues, cardiac issues, that we really want to try to get people to be prevented from. And so for those individuals that are considering not getting the vaccine, what I would ask is just have an opportunity to look at the science and even take an opportunity to see all that go before you to get the vaccine and make a decision based on the facts today and not necessarily on the presumptions in the past, because there's nothing historical about this virus and what we've been through. It is all beginning now and has begun 10 months ago, and the decision really should be made within the context of this vaccine alone.
Yeah, and if you have if you think you have it right now, Kellum Family Medicine, 3401 FM 3009, Roy Richard, we can get you tested. We can get you tested rapid. We can get you tested over the next couple of days, depending on what your insurance covers. But the main thing is to get in touch with a medical provider, and you could do that. Telemedicine. I know that they're our sponsor, but that's a great way. If you have any questions, EasyConnectMD.com is a way you can see a medical professional and get information on this, so you can make that decision. Is it allergies, or because our providers are fantastic and they will lead you in the right direction?
Absolutely. And that is one of the things. So telemedicine was certainly a love of ours for quite some time. But like I said, we've been thrown into this, quite frankly, over this last year. And what I think is really important for people to understand is that it can really replace, in some situations, that face-to-face visit with a doctor. It doesn't necessarily require you to go in and expose you to things, although in
our clinic we're clean, we're safe.
And that is very true. And I'm proud to say that, quite frankly, that we have not experienced an outbreak in our clinic through this 10 months. And I think that speaks to healthcare in general, quite frankly, because all of us are so super focused on making sure the patients are protected and safe. But yes, the telemedicine platform is a wonderful way to come in and ask people about your questions, because the one thing we don't want to live with, and we've done enough of that for 10 months, is the apprehension and the uncertainty of this situation. And so for $39.95, if you have questions and you're sitting on the couch but you're afraid to go someplace or ask somebody, please contact our platform. Our providers will be more than happy to answer your questions, because sometimes it's really important to understand, am I at risk? These are my contacts. This is my exposures. What do I do about it? And many times it's do nothing and let's watch and see. But to feel like you're going to be in the absence of any kind of advice from a medical professional, that just was unacceptable to us. And that's really, I think, a wonderful utilization of our EasyConnectMD.com platform.
And from the vaccine standpoint, there are certain stages that clinics have to. We've received our initial, which is the approval to get the vaccine. We don't have it just yet, but we should be one of the first. So just call our office, 210-921 or 945-2121, and we'll have information on when we'll have it, when we can schedule you for it. It's coming, but in that interim, Dr. Kellum, what's your message to our viewers on the safety and the need to be vigilant still?
There's an absolute need to be vigilant with this. I mean, if we drop our guard in any way whatsoever, and we worsen the spread in the interim, that's just going to be a terrible taxation on our healthcare resources, on the people at the hospital, but more importantly, on your family. And we don't want that to be the case. And so we are in line, God willing, to be able to get one to get the vaccine so we can distribute it. And as the guidelines are laid out for us to understand who gets it first, who's at risk, and how we need to do that, we're going to get that out to our patients so that they understand. I will tell you the other avenue that we have that hasn't been talked about a lot, but we have an ability to be in touch with one of the trials, Johnson & Johnson, which is one of the vaccines that is going to be coming out. One of our good working partnerships heads that vaccine trial here in San Antonio. And that is something that in people who may be pushed to the end of the line because of relatively good health, but still may have a desire to be vaccinated or at least participate in the trials and do something for the community. If they call, we can get that number as well. But that's another avenue that I strongly encourage, because the only way that these vaccines ever come to fruition is for people to volunteer and step up and do something that helps, their humanity, the rest of the people in our humanity.
It's a collaborative effort, isn't it?
It's got to be. And so, science does a part of this. The government has done a part of it, but people have to do a part of it, whether it is upholding their restrictions so that they can maintain space and protection for all around. But even the participation of a cure, I mean, that is a huge component to what's being done. And without that, I think that this never happens. And so, for the people that have participated, we say thank you. For the people that want to participate, there's opportunities, but more importantly, do your part to keep everybody safe. And I think we can get to where we need to be.
All right, Dr. Kellum, thank you so very much.
My pleasure,
Great first effort. Man, it's like you haven't missed a beat.
I must be a pro.
You practice these at night, don't you? Like, hi, I'm Dr. Danny Kellum Jr. Rose, do I sound okay? Look at me. Is that kind of what you do every night?
With my hairbrush.
With your hair? Oh, gosh. Your fake, kind of like brushing your fake hair?
Absolutely.
All right. No toothpaste, please. You look good bald, my friend. All right, folks, that's going to wrap it up. Hey, you're on our Kellum TV YouTube channel. Do me a favor. Click the bottom there. Hit subscribe so that way you can get updates. We're going to be doing these podcasts regularly, and this is a great way of information that you can get on health and wellness in your Tri-County, San Antonio, South Texas, and Texas community. For Dr. Danny Kellum, I'm Gabe Farias signing off. Remember, EasyConnectMD.com is our sponsor, $39.95. You can see a provider online, on time, quickly, 15 minutes, you're in and out. We'll even call a script in for you if it calls for it. Folks, that's it. Dr. Kellum, thank you, my friend.
Good seeing you.
All right, folks, stay healthy.
Bye-bye.